When we think of malaria, we think of the type that occurs once and can be fatal, particularly in children. Vivax malaria, though, is different. You don't just treat it once and it goes away. It can lay dormant in your liver and reappear and make you sick again and again. My name is Megha Rajasekhar, and I'm a biostatistician at the Centre for Epidemiology and Biostatistics at the School of Public Health. For the last 3 years, I have co-led a large project to find the optimal dose of a drug called primaquine that is used in the treatment of vivax malaria. The drug itself has been available since the 1950s, but so far we haven't figured out the best dose. Too little can be ineffective, but too much can be unsafe. If we can work out the right dose, we can stop the spread and eradicate it for good. I worked as a lab scientist for a long time, and then some years later I volunteered to work abroad in Asia and West Africa. And it was those volunteering stints that really showed me firsthand the disparity in public health systems around the world. At that stage, I felt like I had the scientific skills and I had a love for data, but I realized that in order to use data to actually have an impact, I would need a whole new skill set. And the Master of Biostatistics program had that combination of health, data, and statistical skills. This is where I met Professor Julie Simpson, who was the degree coordinator at the time. Julie matched me with 2 great capstone projects. The capstone project is really one of the best parts of the degree, I felt. For this, you're placed with research groups working on actual data and dealing with real problems. And through this experience, you learn how to apply all the theoretical knowledge that you learn in the other subjects to the real world. And now I'm working with current students on their own capstone projects as a way to give back and to share what I've learned. And there's this feeling when you work with data. At first, it looks just like noise. But once you learn the language of statistics, it's like that noise starts to turn to individual notes. And then when you combine it with other data, you get this symphony. It's like there's music hidden in the numbers, and the skills you learn in the degree teach you to hear that music. Julie and I work together now as part of a global collaborative effort to eradicate vivax malaria. So we work very closely with the Worldwide Anti-Malarial Resistance Network, which brings together all these researchers in this massive collaborative effort, which is really what you need to answer these big scientific questions around the world. And really, this has been the key to our success in this project. We are able to be really collaborative, to really have a strong impact, a really tangible impact on health policy, and make a real difference to people who live in these endemic regions. For my statistical work, to have such a big impact is a huge gift, I think, in this area, in this field. Because you start off just learning about statistical theories and equations and numbers, but to see how that can then go and have this real impact on the world, I think that is really satisfying.